At this level of care, we sort of talk about it as the eating disorder and the true person.
Right.
And the true person has been eclipsed by the eating disorder, right? But they can peek out in little moments.
I like that.
And so there's a lot of work around motivation and sort of building a life where you're not sitting in a hospital for a month or 2 months or 3 months. And like, what do you want your life to look like? The eating disorder took away your freedom in so many ways. How do we help you get it back? And a lot of sort of like building towards, what do you really want? What is the eating disorder saying it's giving you? And how do we help you get that in a real way and not a disordered way?
Can you give me some examples of what that might be?
Yeah, I mean, I think that, so for example...
I'm sorry, just to clarify my question. If you're asking the person, like, what do you want that the eating disorder is giving you?
Yeah.
I guess as someone who I don't really have a lot of experience whatsoever treating this, I always refer out because it's just not my specialty. What might they say the eating disorder is giving them? Because from the outside, it seems like, well, what is this thing? What is it giving you? Like, right?
Well, I think that I'll say two things. One is that I think there's this myth that eating disorders are so different than other mental health conditions, and I don't think that's true. I think
glad to hear you say that.
There's a lot of overlap with OCD, which is an area of expertise for you.
Yeah.
And I think that if we were to ask that same question of someone with OCD, they might say that the compulsions, right, like give them relief from anxiety.
Correct.
Right? I think a person with an eating disorder would say something similar.
Gotcha.
That they might have really significant social anxiety. They might have, a lot of social pressure in their life to look or appear a particular way. They might really feel a lot of relief in the context of control over eating or their bodies.
Makes sense.
And so there's a reinforcing aspect of the disorder itself that like reduces pre-existing anxiety or distress. Or creates a sense of like, I did everything right. Very similar to OCD.
Yes.
And it's sort of ephemeral, right? It's like in moments throughout the day, but takes up so much time. And so we often talk to people about, it sounds like you want a sense of calm and mastery in your life, of like peace and feeling like you're good at something. And the amount of energy and dedication and thinking that it takes for a really strong eating disorder. That person could be a surgeon, could be a lawyer, could be a business person.
Yes.
Right, like if their mind was focused elsewhere.
Right.
And so
all this energy went towards something
productive and building a life for themselves.